June is Scoliosis Awareness Month, and here today to help spread awareness and show you what to look out for is orthopedic surgeon with the Connecticut Orthopedic Institute at Hartford Healthcare, Dr. Glenn Russo. Doctor, thanks for being here today.
Absolutely. Thank you so much for having me.
Let's start at the beginning. Tell us, what is scoliosis?
So scoliosis is really just an abnormal curvature of the spine. It could affect children or adults and affects them differently.
And so let's talk about how you spot this. I think I remember as a kid, they used to look at kids in elementary school. Is that still how this is checked for?
Absolutely. Yeah, there's in-school screening, which is more helpful for the kids, or at well-child visits when the kids go in for their yearly physicals. Usually someone notices that something's off. For adults, it tends to be more driven by pain. So they come in either with low back pain or sometimes pain radiating to the legs.
And so these two things are intertwined here. The curvature can lead to pain. Is it over time as it gets worse? How do we get from, oh, there's something there, to pain?
Absolutely. So it's a continuum. You know, with the kids, the idea is to get to it before it starts causing severe pain. For an adult, you know, when arthritis is the main driver, you can have nerve compression or stenosis as a result, and that can cause severe pain either in the back or emanating down into the legs.
Okay, so once you spot this and you know it's a problem, what do you do to treat it?
So there's a whole spectrum of treatments, and usually, you know, we start on the more conservative ends, right? For mild disease, sometimes it's, you know, some physical therapy or some anti-inflammatory medications. Certainly for adults and people who are having more chronic pain, injections could be helpful. And for more severe and progressive curves, sometimes people consider surgery.
And there are some newer technologies and treatments here that are either just out or about to come out, right?
Absolutely, yeah. I mean, you know, spine surgery's come a long way. And certainly in the patients who do need surgery, there are more minimally invasive techniques that dovetail nicely with the robotic options that we have available to us. And there's other techniques of pain control using muscle blockades to help with postoperative pain.
All right, and this is Awareness Month. Why is it so important to make people aware about this?
You know, scoliosis is something that progresses over time. So that means that the treatments and usually the consequences of scoliosis gets worse as more time goes by. And so catching it early allows us more options to improve people's quality of life.
And if you have any concerns, I guess the first place to check with would be your family doctor, right?
Absolutely. Absolutely.
All right, Dr. Russo from Hartford Healthcare, we appreciate your time. Thank you for joining us today.
Thank you so much for having me.